It is best to refer cardiac cases to a board-certified cardiologist. A cardiologist is better qualified to diagnose and treat these cases. But we all know there are clients who choose not to go to a cardiologist due to cost or travel time or some other reason. In such cases, you should record the owner's choice in the patient record, and then, as always, you do the best you can for your patient. Hello, I'm Dr. Craig McInnes, and I will guide you through this training. Even now, most general practitioners who want to learn cardiac ultrasound have minimal instruction and have to figure most of it out for themselves over time. Hence the long learning curve. My goal is to help you become better than I am and to learn faster than I did. Canine mitral insufficiency, or regurgitation, is the most common canine cardiac disease you are likely to see in daily practice. This DVD uses the skills taught in the General Cardiac Exam DVD series, which is a prerequisite. You must already know how to acquire standard right side short axis, right side long axis, and left apical views, how to use color flow Doppler, and how to acquire M-mode, two-dimensional, and spectral Doppler measurements taught in the General Cardiac Exam DVD series. The purpose of this DVD is to help you interpret the results of your cardiac examination to diagnose, stage, and treat canine mitral insufficiency. Should you need to consult with a cardiologist, this DVD will also help you acquire accurate measurements, images, and video to submit to a cardiologist. In cases of mitral regurgitation in human medicine, the cardiac ultrasound is used to determine the timing of surgical intervention for mitral valve repair or replacement. In veterinary medicine, the cardiac ultrasound is used to determine the timing of drug therapy for dogs with mitral regurgitation. Human and veterinary cardiologists constantly evaluate old and new parameters that might reliably stage various cardiac disease processes. Some measurement methods, like VTI, Velocity Time Index, and PISA, Proximal Isovelocity Surface Area, have fallen out of favor, either because results cannot be reliably reproduced or because the measurements are not meaningful for diagnostic purposes. Some of the measurements presented in this DVD could fall out of favor in the future, or new measurements may be introduced. I am presenting cardiac parameters that I feel are most useful to a general practitioner. Approximately 11% of dogs in the United States have cardiac disease, and approximately 85% of those will have mitral insufficiency. Only 20% of dogs with mitral insufficiency will progress to congestive heart failure and require treatment. The problem is to determine which dogs with mitral insufficiency or regurgitation will need treatment, preferably before the onset of congestive heart failure. The intent of this DVD is to show you how to use the information gathered from your general cardiac exam to determine the stage of mitral insufficiency or regurgitation and determine the type and timing of treatment. If you are like me, you will need to watch this DVD several times to understand and develop the basic skills. Then, over the next few weeks or months, you will review parts of the DVD again and again to understand concepts and develop the more complicated skills.